Good morning, good morning, good morning, good morning, good morning, everybody. Good morning. Welcome, 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 welcome. Give me one moment here. I don't know where this screen came from. Give me one moment. What is this here? Oh, that's preview mode. And what is this? I don't know what that is. Hold on. Give me a minute, y'all. Let me see what I got going on over here. Okay, I think I'm good now. Okay, welcome everyone. Welcome everyone to the very first episode of Atmos in the morning. Oh, the chat is disabled. Okay, let me see why my chat is disabled. Give me one moment, y'all. Let me see here. Hold on. Let me see. Let me go into the video. I think I know why. Let me see. Go into here. Into here.
Break every chain. Come on, Timothy.
Here. Hold one moment. Let me see here. Let's see why. Edit video. Let me see. Audience. No, it's not made for kids. Okay. There we go. Okay, this should open up the chat now. Let's see if that works. All right, let's see if that works. Let's see, can y'all chat? Okay, see if that works, y'all. See if y'all can chat now. As soon as I see one chat in there, then I'll go ahead and move forward. Just want to make sure everything is operating correct. Somebody try to type something in the chat, see if it'll come up. I just put something in there. Let me see. Try now. Tell me if the chat is working, y'all. If you could please do that for me, I'd appreciate it. Let me take this other stuff down. Okay. As soon as I get a chat, somebody type something in and tell me if it is working. There we go. Yay, we good. Okay, awesome. Thank you, Warrior. Okay, hey, Miss Jennifer, how you doing? Good morning, everybody. This is the very first episode of Atmos in the Morning, where we are going to talk about what's going on in the world. We're going to talk about things that matter. We're going to talk about things that can help to give us a different perspective on life, a different perspective on where we're going and what we're doing. Hey, PG, how you doing? Good morning, Jennifer. Good morning, y'all. So there's a couple of things that I wanted to start off with. First of all, I want you to know that if you are listening to my voice this morning, that you are special, that you are blessed, that you are good, and that God took the time to wake you up this morning because he wanted you to be a part of this day. Okay? So I want you to, no matter what you're going through right now, no matter how depressed or how sad, how upset, or whatever you're going through, I want you to understand that you are here for a reason. And that reason is because you are supposed to be here. God don't make mistakes, okay? There is a reason for everything. There's a season for everything. And the fact that you're here right now, able to listen to my voice, is showing that you are valuable and you're worth being here, okay? If you will please come in and hit the like button, I would greatly appreciate that. This is our first show of doing Atmos in the Morning. We are going to do this show on Monday through Friday from 8 a.m. to 8:30. I'm a little bit late this morning, but I will go over just a little bit to make sure that I cover what I want to cover. This will not be a drama show. This will not be a show where people can, come on to, spread any type of negativity. This is going to be all about knowledge, all about positivity, and all about growth, okay? So there's a couple of things that's going on in the world right now, y'all, that I think that that because we don't talk about it as much as we used to, people kind of let stuff kind of pass through, they kind of lay back on If there's not a sense of urgency in the public, then people don't tend to think about it. People tend to think about whatever's on TV. So if it's not on TV, they feel like it's not serious. And that is totally not true. One thing I want to definitely bring up is, and I was looking at my phone this morning, I saw here on CNN that there is it says here that there's a surprising amount of deaths will soon occur in these U.S. regions from an increased COVID-19 cases. So this new Delta variant, y'all, that they've been talking about, is pretty serious. And, I've noticed, I saw a basketball game the other night where there was literally, I think it was the Milwaukee Bucks against the Phoenix Suns. And they were playing in Phoenix, but they were showing the crowd on the outside of the stadium watching it on the big screen. And when I tell you it was thousands of people packed into this square, they call it the deer lane or the deer zone, the deer district is what they call it. And when I tell you there was thousands of people packed in together, and I didn't see one mask, not one. And I'm sitting here looking at this like, is this for real? And it's alarming that, like I said, when people don't see it in their face, when people aren't talking about it, people just kind of let it slip their brains. And we can't do that, y'all. We can't do that. We have to be diligent. We have to be smart. We have to be, think about, what about my family? What about my children? What if I go out here being nonchalant and I go to the grocery store and, hey, Mom, Life, Love, good morning. And I go to the grocery store and somebody's in line coughing and hacking and I'm just simply not thinking, and I breathe it in and take it home to my family. Like, and yes, I know that they have this thing out now where they say if you're fully vaccinated, then you don't have to wear your mask and all that. I'm sorry. Even if I was fully vaccinated, I would still wear my mask because they're still doing clinical trials. There's still not enough, in my personal opinion, this is just my opinion, I don't feel as though there's enough research out there to show and to back up and to stand behind the fact that getting those COVID shots will prevent you from getting it again. I've actually seen cases of people getting the shots and still ending up catching it. And so when Dr. Fauci went on and said people that are fully vaccinated don't need to wear their mask anymore, I was just like, that's crazy. So my personal advice to you would be careful no matter what. Be careful no matter what. I would still wear my mask when I go out in public. I just wouldn't take that chance. I just think that just because the public and the news media isn't covering it as much does not mean that it is not still a threat. So please, this new Delta variant, y'all, I'm just going to read some of the information I see here. Now this is, you can always go to, I'm still learning how to navigate and pull in screens and all that kind of stuff, but I don't want to get this video copyright struck from CNN. But I want you to know that what it says here is that the CNN, as the Delta variant rapidly spreads, the U.S. hotspots have seen climbing cases, and an expert warns a surprising amount of COVID-19 deaths could soon follow. The U.S. is averaging about 19,455 new cases over the last 7 days. That's an average of a 47% increase from the week before. Let me read that one more time. The United States is averaging about 19,455 new cases over the last 7 days. That is a 47% increase from the week before. Tune, what's going on, my brother? Good morning. That's a 47% increase from a week before. It says here, according to data from Johns Hopkins University, and a third of those CNN medical analyst Dr. Jonathan Reiner said some come from 5 hotspots. These are the 5 hotspots, y'all. Florida, Louisiana, Arkansas, Missouri, and Nevada. I'm going to say that one more time. The 5 main hotspots that they have seen an increase in new COVID cases over the last 7 days, 19,455. These are the hotspots. Florida, Louisiana, Arkansas, Missouri, and Nevada. It says in places like Missouri, where ICUs are packed, you're going to see a surprising amount of death, Reiner said on Sunday. It says at Mercy Hospital in Springfield, Missouri, 91% of ICU patients are on ventilators. And many are in their 20s, 30s, and 40s. I'm going to read that one more time. If you are in Missouri, listen to this. 91% of ICU patients at Mercy Hospital in Springfield, Missouri. 91% of ICU patients are on ventilators, and many of them are in their 20s, their 30s, and their 40s. I'm 41. There's a lot of our kids that are in the 20s and 30s. Like, when I tell y'all that this new Delta variant, they have no info on it. They don't know what to do with it. They don't know what to do about it. They don't know. It's too new. It also says here that the Chief Administrative Officer, Eric Frederick, told CNN Saturday that is especially concerning, he said, because at the peak of last year, there were only 40 to 50% of ICU patients on ventilators. So think about this, y'all. What they are saying is that lately, over the last 7 days in Springfield, Missouri, 91% of ICU patients are on ventilators. They said that that's extremely concerning because he said at the peak of this virus, the peak, he said there was only 40 to 50% on ICU patients on ventilators, which means that whatever this new variant is much more dangerous and much more lethal. I am coming here to say to you, don't stop wearing your mask. Don't stop taking precautions. Don't stop sanitizing your hands. Don't stop. Don't stop. It says here, typically increases in COVID-19 death rates follow 3 to 4 weeks behind spikes in cases. Reiner said, it takes a week for patients to get sick, at least sick enough to need hospitalization, and then often another couple of weeks for the infection to become fatal. Wake up, people. That's right, Dynamite. Wake up. Wake up. Wake up. Wake up. Wake up. It is not over. Miss Jennifer, that's good. Yeah, oh PG, yeah, I have autoimmune disease, so I take no chances. Don't take chances with this, y'all. So as you see here, it says it takes a week for patients to get sick. So a week for patients to get sick enough to need hospitalization. And then often another couple of weeks for the infection to become fatal. It's serious. It says we will start to see an increase in mortality in this country, Reiner said. So they are expecting, they are forecasting that we are about to see a lot more deaths. This is not being pushed on the regular public, on the regular TVs. I'm not seeing a heightened alert. So that is why I'm going to use this platform to further enhance the knowledge that you all are getting. If y'all will please hit the like button. I got 20 people watching, only 6 likes. If you'll please hit the like button for me, I would greatly appreciate it. It says here, what is particularly frustrating for many experts, Reiner said, is that the deaths are completely avoidable. Let me read this again. It says here, what is particularly frustrating for many experts is that the deaths are completely avoidable now that vaccines are available. But about 1/3 of those 12 or older in the United States haven't received the vaccine yet, the CDC data shows. The vaccines we have work really well against this variant. It doesn't need to be this way, Reiner said. Experts weigh whether vaccination should be mandated. Here we go. Here we go. Somebody was saying to me yesterday they're probably about to mandate these vaccines. It says here, much of the rise in cases have been attributed to the now dominant variant, Delta variant, which is believed to be more transmissible. And the variant has sparked discussions over local vaccination mandates. Across the United States, 48% of the population is fully vaccinated, but in some states the number is much lower. According to the CDC data, Alabama, Arkansas, Louisiana, Wyoming, and Mississippi all have around 35% or less of their populations fully vaccinated. Experts say vaccines are key to managing the spread. With information changing rapidly, it is so important to be smart about how vaccinations are mandated. Professor of Medicine, George Washington University School of Medicine, Dr. Gigi L. Boyomi said, in states where there are high vaccination rates that are like 75% or above, it makes sense to loosen up the restrictions in places where there are not, such as the same in some of the southern states. It makes sense to mandate vaccinations. They are talking about mandating these vaccinations, y'all. Dr. Anthony Fauci, director of National Institutes of Allergy and Infectious Disease, told CNN he thinks it's a good idea for mandates at the local level. Good morning, Shirley Williams. Good morning. Hey, Missy Powell. It says here, we're talking about life and death situation. We've lost 600,000 Americans already, and we're still losing more people. There have been 4 million deaths worldwide, Fauci said. This is a serious business. That's an interesting group of words to say. This is serious business. It is business too. It's business too. He added that he expects vaccine mandate hesitancy to lift when vaccines are fully approved. Right now, the available COVID-19 vaccines are being administered under emergency use authorizations, which Fauci said has made some people skeptical as to their safety and efficacy. It says, but the amount of data that supports the importance and safety of the vaccines is more than anything experts have seen for the EUA, he said. These vaccines are as good as officially approved, with all the I's and T's crossed. These vaccines are as good as officially approved. Okay. Pfizer to brief the United States on boosters. Man, let me tell y'all something. This is business too. This is business too. Let me see what Miss Missy said. Miss Missy said, PG, I got both the vaccines and ended up getting sick and was sick for 1 month and 3 weeks. I felt like I was going to die. Well, praise God that you're here. Praise God you're here, sister. Thank you for the dislike. Hey, y'all, if you do me a favor, we got 20-some people in here and only 8 likes. If you would please just hit the like button for me, I would greatly appreciate it. Also, it says here, Pfizer will virtually brief the United States government officials Monday evening regarding the potential need for booster shots of its COVID-19 vaccine. A company spokesperson and 2 administration officials confirmed to CNN. The meeting is seen as a courtesy, and federal guidance on boosters is not expected to change immediately following the meeting, a senior health official said. Last week, Pfizer and BioNTech reiterated their expectation that people may need boosters to their vaccinations in the next 6 months to a year, citing waning immunity they are seeing among people who receive their vaccine. So, what they're trying to say now is yes, people are getting the vaccine, even 2 shots. But the immunity is starting to wane. It is starting to lessen off. Now they talking about these boosters. So for people who got the shot, said they got sick from the shot, and did it to be precautious, now they're saying, hey, you're going to probably need a booster shot. Says here, the company also said it would seek emergency use authorization for a booster from the U.S. Drug and Food Administration in August. But some experts have argued that the data is showing boosters are not necessary yet. Americans who have been fully vaccinated do not need a booster shot at this time, the U.S. Centers for Disease Control and Prevention and the FDA said. The FDA, the CDC, and the NIH, the National Institutes of Health, are engaged in a science-based, rigorous process to consider whether or when a booster might be necessary. So they're saying a science-based way is how they're tracking when a booster is needed or not. Fauci also distributed the need at this time on CNN's State of the Union. Given the data and the information we have, we do not need to give people a 3rd shot. A boost superimposed upon the 2 doses you get with the mRNA, the Pfizer or BioNTech or the Moderna vaccine, and the 1 dose you get with the Johnson & Johnson. So, I don't... listen. I want to encourage people to... If you feel like you want to get the shot, get the shot. I don't want to discourage anybody from getting the shot. If you feel as though that it is going to help you be safe. Hey, Stan Lackey, what's going on, brother? So... But I want you to be smart too. If you were already sick after you got the shot, I probably wouldn't rush to get another one. Just my opinion. If you already had the shots and you was already sick, my son is in the military. They are mandating them to take the shots. Now, my personal opinion, and I don't have any evidence to back this up, but my personal opinion would be that the Pfizer and the Moderna are probably two of the better brands. This Johnson & Johnson shot, which is the one that they are giving the military, my son is 19, extremely healthy, no health issues. He was sick for 2 weeks after they made him take the shot. They gave him the Johnson & Johnson. He was sick for 2 weeks. Said that he couldn't talk. He had shortness of breath. He would call me and I'm asking, how you doing, son? He's like, oh, I'm okay, Dad. I'm like, this damn, listen. YouTube, the public don't want people discouraging people from taking a shot. So I'm not going to discourage anyone from taking this shot. You need to do what's best for you. I would just say personally for me, I haven't taken a shot yet. I am extremely precautious when I leave my house. I always keep mask. This is my life. Here. I'm not playing. I'm not playing. Every day, it's a new mask. Everywhere I go. Everywhere I go. I'm not playing. Until I see evidence that it is safe to do this, no matter what brand you take, I am going to err on the side of precaution. Oh, really? Your job mandates it, Dynamite? And I know some jobs do mandate you to take the shot. I get that. Good morning, Tears. Good morning. How you doing? Let me see. I don't want to miss anybody's. Hey, Uniquely Made. How you doing? Uniquely Made said, I'm still working from home. Hence, meet with all my clients via Teams. Thank God I'm self-employed. Thank God you are. That's awesome. That's awesome. Let me see. PG said, my dear friend, Lowdown, got the shot, and it landed her in the hospital. She is much better now, but it countered her. It countered her MS. Wow. Man, I'm glad she better. We love Lowdown. We love both of y'all. Let me see. Oh, Jennifer said the Johnson & Johnson vaccine is only good for 8 months. Huh. Let's see what some of y'all are saying. Some of this is probably about money. Hey. Thank you so much for these updates. As we can see, COVID is not over by any means. Absolutely, it's not. Shirley Williams said the government can create a problem and then give us a solution. Real talk. Yeah, Missy, I'm glad you made it through. I'm glad you made it through. PG, I got the vaccine and ended up sick. I was sick for 1 month. I felt like I was going to die. Yeah, man. Listen, y'all. Listen. Don't trust Johnson & Johnson anyway. Yeah, Johnson & Johnson. I tell you what, they've been really suspect lately. My nephew had his second shot. He is complaining about headaches. My son did the same thing. Uniquely made. How old is your nephew? How old is your nephew? Let me see. I haven't taken the shot either, Brother Atmos. And not going to. Neither am I. Listen, y'all. Listen. That's just, listen. Let me say this again. YouTube, I am not discouraging. They struck one of my videos before because I was telling people the opposite of what I'm saying right now. So what I am saying now is anyone who feels like they need to take the vaccine, take the vaccine. I'm just saying that I haven't done it. I have never had COVID. I am simply going with the precautionary things of wearing a mask everywhere I go in public, and also sanitizing my hands and not still. He's 25 years old. Wow. And you would think, like, we young like that, we think that, like, our immune systems are so powerful that we can fight off anything, right? It's crazy. Mom Life Love said in the Netherlands was 1 week mask free. Now they starting again because the numbers rising again. I'm just saying. Now they talking about the third short Pfizer. Man, third shot. Okay. I'm blessed to be self-employed as well. And that's awesome, y'all. That's awesome. Now, my particular profession, I actually have to go. Yes, do what you think is best for you. I'm not taking it. Hey, everyone is entitled to their own, unless you work at a job where they mandate it, especially in the health field. I've noticed that a lot of times they'll tell you, well, you're not allowed to work here unless you have the shot. You know what I mean? Because we don't want you around our patients or whatever. Tune. Yeah, Tune said he got the shots. Tune, how did you do after you got the shots? Were you okay? Did you, did you have any effects from it, or was you just fine? Y'all don't get me wrong. There are some people that are just perfectly fine after they take the shots. I've had people tell me, Atmos, I had no side effects. Nothing was wrong. Everything was good. And listen, for those people, I say more power to you. More power. More power. It's just not for, everything not for everybody, Everything not for everybody. There are too many shots. Yeah, I agree. It's too. Listen, here's the part that alarms me personally. It's too many companies. It's too much like competition. Like, why can't they just have one company that has been tested to show an extremely high? Like, why not have like all these different companies? You got Pfizer, Mendoza, and Johnson & Johnson. Do tests, do your clinical trials, and say this particular. Oh, you had headaches, Tune? Are you fine now? Are you okay now? Why can't you just have one where you say, okay, out of these ones that we've tested over clinical trials with 20 people with each trial, this one here had a 90% cure rate. This one here only had 70%. This one here only had 40%. So the 40%, you out. The 70%, let's do another trial on you and see if y'all can get y'all percentage up. The 90%, let's do another case. Why can't you just do the process of elimination instead of just saying, hey, I want to give y'all an option. You can go with Johnson & Johnson. You can go with David or David. You can go with Leroy. You can go with John Gold. You can go with... Just give people the vaccine that gives them the highest probability of being able to survive this. That's just my opinion. I think, and people are, they're nervous about who they should take. Do you know enough about the difference between Pfizer and Johnson & Johnson? Do you know the difference between Moderna and Johnson & Johnson? Like, what are the side effects? What are the differences? Why should I choose this vaccine over this vaccine? Let me see what y'all saying here in the chat. The Tuskegee experiment. Indeed. Good morning, Bev Davis. How you doing? Let's see here. Here's the irony. If mandated to take the shot and get COVID, you can't sue. There you go. There's no liability to the government if you get these shots and still get it. Now, maybe that's because they're giving people the shot for free. So they feel like, hey, if you're not paying for it, then you can't come for us for no money. This is your choice to take it or not. Right? I just want to inform my people that listen to me to do what is best for you. Don't take this lightly. Don't be ashamed to consult God about making a decision on something you're gonna put in your body. I don't want people to say, well, Atmos said don't take it, so I'm not gonna take it. No, what I'm saying is do what's best for you. You have to take that chance for yourself. I personally haven't seen enough that makes me feel confident enough to take my family down and say, hey, y'all, we all are going to go with this company and we all going to go ahead and get our shots. And until I see that type of data, and no one in this house has ever had COVID the whole time it's been out because we've been wearing our mask and sanitizing our hands and being careful and social distancing, then until I see data that speaks otherwise, and people in my house have like medical issues, so it's like, they could trigger if they get the wrong thing inside their system, and so you have to be careful. You got to be smart about how you doing with your family, okay? And I'm sorry, I know I spent a lot of time on that, but it's real, y'all. It's real, and I want y'all to please don't take it for granted, okay? Here's something else I found that was very interesting. Richard Branson. This guy's one of the richest men in the world. I thought it was pretty amazing that let me see here. All right, it says here that this man was able to, let's see if I can blow it up. It says billionaire Richard Branson reaches space in his own ship. Truth or consequences. It says swashbuckling billionaire Richard Branson hurtled into space aboard in his own winged rocket ship Sunday, bringing astrotourism a step closer to reality and beating out his exceedingly richer rival Jeff Bezos. The nearly 71-year-old Branson and 5 crewmates from his Virgin Galactic Space Tourism Company reached the altitude of 53.5 miles, which is 86 kilometers, over the New Mexico. Over the New Mexico desert, enough to experience 3 to 4 minutes of weightlessness and witness the curvature of the earth, and then glided back home to a runway landing. The whole thing it was just magical. A jubilant Branson said on his return aboard the gleaming white space plane named Unity. The brief up and down flight, the space plane's portion took about 15 minutes, or about as long as Alan Shepard's first U.S. space flight in 1961. was a splashy and unabashedly commercial plug for Virgin Galactic, which plans to start taking paying customers on joyrides next year. Branson became the first person to blast off in his own spaceship, beating Bezos, the richest person on the planet, by 9 days. He also became the second septuagenarian to go into space. Astronaut John Glenn flew on the shuttle at the age of 77 in 1998. Bezos sent his congratulations, adding, "Can't wait to join the club." Then he also took a Twitter account. Okay, so y'all, listen, technology these days is crazy. How many of y'all would go on a joyride to space? How many of y'all would do it? How many of y'all would go into a man-made space shuttle and go to space? I personally, I find space and things like that to be very interesting, right? I think you have to understand the risk that will be involved with that. Hey, what's up, Aisha? You know what? I would too, but I would have to make sure that like I got plenty of oxygen. I would have to do, man. Look, especially if you know that I would just think about not being able to have control over, you just floating and all this kind of stuff. It would be really, really, really weird. But like I would be scared as I don't know what. I'm being real with you. I would be scared that like if let's say they land on the planet and like they say, okay, go ahead and get off and walk on the planet. Oh hell no, not me. I would be too nervous that I'm gonna float off and go towards the sun. No way, not me. I couldn't do it. I don't care. That's just too crazy. Let me see what y'all talking about. Passionately Gangster said, if I had a choice from YouTube and space, I choose space. I don't blame you. As Jennifer said, I'm good. There's enough aliens around here for me. I just flatlined on live. Now, you silly. That is funny. It is. It's a lot of aliens out here. Uniquely Made said, I would in a heartbeat. Okay. That's what's up. I ain't hating on you. Tears said, outer space is interesting. It's very interesting and a scary thing at the same damn time. Now, here's the thing, y'all. Just think about it. Like, just think about you in a spaceship and you going up and you seeing Earth like down over here, and you up above and you seeing stars and all kind of like, and then somebody will say, hey, why don't you get out and go ahead and walk on Mars or walk on... No man has ever walked on this planet before. Why don't you be the first one? Who? Me? Walk on here when no other human beings ever walk? You want me to be the guinea pig? Hell no. It ain't gonna happen. It's not gonna happen. There is no one there to save you. Exactly, Granny. Granny said there's no one there to save you. Exactly. Just imagine you up there and like let's say that like the weight limit for those little like ropes that like hold you, that connect you to the actual thing. Let's say that thing snaps and you just go floating away. What you gonna do? Think about it. Some things I just don't think that places we meant to be. And I don't know if that's one of them. Right? I'll let the astronauts and NASA and all them do what they do. Oh yeah, okay, uniquely. You say you're a risk taker. That's what's up. And that's probably why you're a successful business owner, because you take risks. Yeah. So I think that's pretty neat, y'all. That people are using their entrepreneurial skills and their money to create ways to make money. Free my bro Larry. Larry was all about creating businesses to help bring in revenue. And if you have money already, then why not do it creating a space rocket, which he has, and saying, okay, well, you pay me $20,000, you pay me $30,000, you can go to space. Think about it. All right, y'all. And then the last thing I want to talk about is the game last night, man. I wanted the Phoenix Suns to win so bad. I want to see Chris Paul get him a championship. But the Milwaukee Bucks was able to win in Game 3 at home, 120-100. The Suns just simply did not stand a chance last night. I watched the game. They tried, but it didn't work. So shout out to Giannis and the Milwaukee Bucks in taking a Game 3 win. It is a best-of-7 series. So it could have been, and I'm one of those people where I try to think outside the box, especially when it comes to like sports stuff. Like when we had 9/11, I remember that the New England Patriots won the Super Bowl that year. Okay. So I look at all that kind of stuff. All of it, right? So shout out to the Bucks. We'll see what happens. But listen, y'all, I got to get ready for work. I wanted to come on here, let y'all know I love y'all. Thank y'all for tuning in to Atmos in the morning. I will see y'all tomorrow, and we will continue to put out knowledge, and we will continue to enhance and grow people's perspective in life. I want to encourage you to have a blessed day today. Understand that you are amazing, you're awesome, and you are here for a reason. Everyone have a blessed day. Say something good to somebody today. Encourage somebody else, okay? I love y'all. Have a blessed day. Talk to y'all later. If you'll please also leave a comment down below if you like the show, if you like the information, if you would like to be a blessing to my channel, just to say, hey, man, we support you, you know what I'm saying? Even if it's just to help you cover the cost of running the program, please hit the Cash App, $ this blessed house, or you can PayPal me at Atmos Love, okay? I love y'all. God bless y'all. Free Larry. Peace out.